In this video, we'll be talking about exercise, and there are 6 parts to this video. When everything feels tough, it's hard to get up and go to work, and even tougher to exercise after an early start and a long day. If there's mental health issues, it can be even harder to find motivation. When you do manage to do it, chemicals in your brain give you an energy boost. If you have mild depression, exercise is as good as antidepressants. Try and see if you can go for a walk or jog to the end of the road. There's no cost and no equipment needed except for some shoes. Grab a rugby ball and head to the park with some mates for an hour. Break it into 10-minute sessions if necessary and then build it up till you get about 30 to 60 minutes. Moderate exercise 5 times a week. Moderate exercise is breaking a sweat, but you can still talk. And if you aim for 5 days to do exercise and only manage 3, you're still generally within the recommended levels of exercise. If you go for a walk to the park, chances are you get fresh air and sunshine too, which will all help prevent or coping with mental health issues. In New Zealand, we need to find a balance between ensuring we don't get skin cancer, but we do get enough vitamin D. The best times are approximately before 10 AM or after 3 PM. If you have unprotected sun exposure on your face, arms, 3 to 4 times a week, vitamin D should be enough. In winter, it's a bit harder, especially if you're working indoors, so try and step outdoors on your breaks. Exercise can be extremely beneficial in assisting to prevent and control many of today's common health conditions. Some of these include diabetes, mental health, cancer, coronary heart disease and osteoporosis. Diabetes. Exercise is the main way of preventing diabetes and managing both type 1 and type 2. Strength training and cardiovascular exercise help develop muscle fibers that are more responsive to insulin. They do this by creating high capillary density and greater blood supply, which allows insulin to work more effectively at regulating blood sugar levels. Cancer. In New Zealand, each day about 50 people are diagnosed with cancer. It's estimated that approximately 80% of these are caused by lifestyle or environmental factors, which means they are preventable. Regular exercise is one way to reduce the risk of common cancers like breast cancer, colon and prostate. Research shows that being active during cancer treatment has a positive effect on mood and well-being. Osteoporosis, brittle and fragile bones. From the loss of tissue is seen as an older person's problem and that nothing can be done about it. But it's agreed now that taking action early on in life can prevent osteoporosis in later life. Prevention involves having adequate vitamin D, calcium, weight-bearing and high-impact exercise. When muscle pulls on bone, it builds bone. So weight-bearing exercise builds denser, stronger bones. The more bone mass built before the age of 25 to 30, the better. Coronary heart disease, high cholesterol, high blood pressure. About 40% of deaths in New Zealand are due to coronary heart disease, which makes it our biggest killer. The heart muscle responds well to exercise, getting stronger, pumping blood more efficiently. Exercise can also influence cholesterol to improve its composition of good and bad lipoproteins. Over the long term, exercise can lower blood pressure, which is a contributing factor to coronary heart disease. Let's look at some of the most commonly asked questions on exercise. Is bed rest good for lower back pain? Not necessarily. Bed rest will relieve muscle spasm, but it severely limits movement, which is needed to move nutrients within the vertebral discs. Not moving can cause loss of strength, which in turn can slow the spine's ability to heal. Generally maintaining a normal activity rather than staying in bed will speed up your recovery. Can you be fat and fit? Yes, you can, but carrying an extra few kilos may not be an issue if fitness markers are good. These include oxygen uptake, lung efficiency, heart rate and blood pressure. Does exercise aggravate arthritis? No, it doesn't. However, a lack of exercise can make joints more painful and stiff. Utilising joints helps in the transport of nutrients and waste products to and from cartilage, which protects and cushions bones. Strengthening the surrounding muscles also helps support the joints. Some types of exercise are better than others for arthritis, so consult your doctor first. Does exercise aggravate asthma? Some people can suffer from exercise-induced asthma. However, those with asthma who exercise usually experience fewer symptoms and cope better when they do have an attack. A recent study has found that physical activity improved asthmatics' ability to take up oxygen and improve their breathing. Mental health conditions are quite common in society today. 1 in 6 New Zealanders will be diagnosed with a mental disorder, including depression, bipolar disorder, or anxiety at some stage in their life. Medication or cognitive therapy, which is problem solving about a person's current thinking, behaviour and communication, is very helpful. There is a growing evidence saying that regular exercise can be extremely effective for people suffering from mild to moderate depression and anxiety. Sometimes exercise can manage depression and prevent relapse as effectively as medication, with none of the not so great side effects. Physical activity does not need to be particularly energetic to be of benefit. Moderate exertion 3 to 5 times a week can significantly reduce symptoms of depression. Improvements can be seen from a single episode of exercise in less than 10 minutes. When you exercise, important mood-enhancing hormones called endorphins are released. These are happy hormones that can lift your mood and make you feel more positive. A blend of cardio and resistance exercises will be ideal, but anything that you enjoy can fit into your lifestyle would be of benefit. If you're new to exercising or have any injuries or medical concerns, your GP or personal trainer will be able to tell you the best types of exercises, gently and safely. It can be a catch-22 with exercise and mental health. If you find it hard to get motivated when feeling low, remember, the more you get into a regular pattern of exercise, the better you feel, and the more you want to make it a lifestyle habit. Here are some tips to help you exercise. Play the game. I'll just do it for 10 minutes. This means you get at least 10 minutes of exercise. But if you feel like you need to stop afterwards, you can. But endorphins will kick in, which means you can do a longer session. Play your favourite music. It motivates you to move and it lifts your mood. Get your workout clothes ready the night before, so it's easier to put them on. Try to exercise early in the day. Quite often something comes up, which means you end up missing exercise altogether. Make a fixed time with a friend or workmate or personal trainer, as it's harder to let other people down than yourself. Commit to a class or activity. This means you can connect and socialise as well as be active. Plan ahead and put reminders on your phone, so you treat your exercise as you would as any other important appointment.